all.
Assalamualaikum, Doctor.
Anyone here who can't understand Urdu, so we should do in English, otherwise we can't do Urdu. Okay, so all are from Pakistan, I think. Okay, good. Yes, Dr. Lina, thank you, Dr. Sami, Dr. Usman. Okay, many people are from MRCEM. Dr. Amal, I know. Dr. Monsarza. Okay, Dr. Asad, I know. Dr. Sami, Dr. Zaid, Dr. Hamza. Okay, Dr. Nasir, I know. Dr. Sumana, Taiba, Dr. Tariq, Zaimam. Okay, mostly I know. Voice is not clear? Either
It's audible, but it is audible, but not very clear.
no, internet issue. Now I'm audible?
Better, sir, better.
Good. So, okay, how many have attempted the MRCEM intermediate? Voice is still not clear. Either it's audible.
Now it's much better. Now it's clear.
What's the problem? Is there any distortion, echoing? Okay, why it's echoing? Okay, Dr. Munsa. Welcome, Dr. Munsa from Toronto. Okay, have you passed the MRCEM family? Still my voice is not clear? Dr. That anyone else can?
Sir, it is audible. Sometimes it breaks off a little, but it's better now. It's better than before.
Let me, because I'm using my mobile data, that can be the reason. I take a lot of session on daily basis from here. Just wait, I may change my position. So I think better. Now I'm audible? How's the voice now?
Yes, sir, much better.
Okay, that's good. Dr. Ahmed from UK, that's good. But I'm unable to attach my charger here. Okay. Assalamu alaikum to all. Hope more than 30 people have joined, so we should start. So my name is Dr. Badr Markizir. I am the trainee of London Global Emergency Medicine Program, which is directed by the Dr. Ishfaq, my mentor. He is consultant emergency medicine in NHS and UK. What's on FGM? They know me. But the other people who have recently joined first time, they don't know. So I have passed my MRCEM recently, full MRCEM, and I have done MRCEM primary, intermediate, and OSCE.
चीजें ठीक आती हैं यहाँ पे थोड़ी सी मेहनत करेंगे खाली जैसी आती है वैसी ही करेंगे
इधर भाई शुरू कर दी कुछ लोगों के अफ्तारी करीब है यूके में
बाहर वाले खाने से लाखों कर देगा
So I was disconnected. No voice is clear. Sorry for the disturbance. Okay, good. My recording. I don't know why. Okay, so I was telling that I have already connected the webinar on the MRCEM pathway, what are its benefits, how many parts, and today the special session is about only the MRCEM SBA. It would be beneficial to who have already passed the MRCEM primary. So I was asking, can you tell me who are going first time for the MRCEM SBA? Yes, in the group. That Mana Hamza. Okay, first time. Okay. So who are going second time or third time? They have already attempted the exam. Okay. Dr. Ahmed, are you working in UK? Dr. Taiba. you are working for asking for company. Okay. No one. Good. Oh. So I will also tell to the candidates, the LGM, who are from LGM, how they approach the exam, and who are not from LGM. That will be, both will be. Okay. Okay. So the main thing that failure is not the ending of anything. Okay. So failure is the one step closer to success. If you fail and you are disappointed, that means you are failed. Okay. If you fail and you take it positive, that means you will pass next time. Okay. So as from people who are from LGM, they know me that I failed my MRCP exam last night in June. I attempted, although my mentor was saying that don't go for exam, but I attempted, I failed. But I took it positive. When I got this seat this time, I prepared well. I did hard work. When I came out of the center, I was sure that I will pass this time. So that means if I was disappointed, I say that I could not pass, I can't pass, I will not go for exam. Because this time when I was going for exam, I was thinking to go for exam. So people were also saying that you're not well prepared, go for exam, don't go for exam. But you must believe on yourself. And the other thing that important is the smart study. Okay. Hard work, but do smart study. Smart study is a very typical term which you should use when you are going for any exam. I will say that when we prepare for the MRCM intermediate, we were calculating the days. We used to study in group. We were 4-5 friends, but we calculated there were only 65 days. We also studied MRCM primary in a group form, and there was only but for the intermediate, when we passed, that's the smart. We did the smart study. We did not cover all the syllabus, but we passed. That was smart study. But the most important is that if you are failing, and you are getting disappointed, that means you will never pass. If you one time you fail, you come back with a better preparation, and you believe in Allah, and you believe in preparation, and you do some smart study, you get the guidance. I know many people from other than LGM and also from LGM. There are many people who used to ask me how to prepare for the MRCM primary, and that what sources I should use, how to prepare, what should be the plan. When they pass the MRCM primary, they vanish. They don't ask. They think that MRCM primary is very easy. So I will also pass the MRCM intermediate. But MRCM intermediate is not easy. MRCM primary and OSCE, you can say that high passing rate. But for the MRCM intermediate, very low point. So today the purpose of this session is to tell you that how you should prepare, how should you focus on the studies, what field you should focus and what you can leave, and that's the main purpose of this session is. Okay, I have done my introduction, so everyone knows me from the LGM. The other thing is MRCM SBA. If who have not attempted them, that's the theory exam. There will be 180 question like MRCM primary, but that will be done in 2 sections. Okay, so 90 MCQs in first half, 2 hours. You have 2 hours and 90 questions. But literally, when you have attempted the MRCM primary, maybe some of you left out of the exam center before time, like some have done the 180 MCQs and 1.5 hour, 2 hours. I did my MRCEM primary. I was left with 1 hour, and I was thinking, what should I do? I repeated all MCQs once, then second time, then I came out. But when I was going for the MRCEM SBA, when I was in the paper 1, I was short of time. And everyone know who have attempted, you will be short of time because there will be a very lengthy attempt and very lengthy answers. So you have to choose from them. So that's why 4 hours, you are thinking that these are 4 hours, mean 240 minutes, and these are not sufficient. So 2 hours with a 1 hour break in the middle. So like same Pearson Wood Test Center, you can also attempt at the home, but I will not recommend that usually. Who have already attempted, I have asked from you, so you must not be disappointed. There are people who passed on first attempt, someone will pass on second attempt, someone will pass on third attempt, someone will pass on. But I know that my colleague they're from Bangladesh, one is from Iran, other from, they passed their exam on sixth attempt, on last attempt, but they passed, and when they went for the OSCE, they passed it on first attempt. So that's why don't be disappointed. Maybe you are wasting your time on SBA. You will pass MRCEM OSCE in first attempt. So all the time period will be covered. So the consistency is the key to success. If you are consistent, you are not getting disappointed. You know that what's your targeted. You are not getting distracted. You will pass one day. Don't miss the chance. Every attempt you will go for the exam. Okay, I know it will drain you financially, but when you will pass, you can ask me. I have attempted 2 times MRCEM OSCE. I have spent more than 1.5 million, but I don't feel that I have spent it because I have passed it. When you will get your journey, then you don't know what the difficulties you have gone through. So anyone here who have got more than 110 marks and he failed or she failed? Okay, who have got 100 plus and who have got less than 100? Okay. Okay, the most important thing, the people who have got more than 110, they are at risk to fail again. You will think why? Anyone can answer it? From the people who have got more than 110 because they failed with very few marks. Dr. Ahmed, Dr. Hassan. Okay, so why I am saying that? Because when you fail with the margin, you think that you are well prepared. You failed with a little marks, 1 or 2 marks, and then you will pass next time easily. So you take it easy. But next time you are at risk because when you fail with 1 mark, that means you are failed. You are zero. You should prepare from the zero. You should work hard more as compared to the other. Okay, that's the main reason. Who have failed with 1 mark, 2 mark, 3 mark, or 4 mark, they should work hard more. Always remember it. These are my words. You will remember. You will pass next time. So don't worry. So who are above 100, they can also pass, and 90 who are less than 100, they should also work hard. That's the main purpose I was telling you. So these are the two my, this one is the marks from my friend, with my childhood friend. The other is my junior, and he failed at margin 113. And when I asked, he was saying that I will pass next time, like I told. And the other also failed the second time. And the reason is that when he was going for American primary, he used to ask me, should I teach, should I read this, should I read this, should I not, what should I do, know what. But when he went for the American intermediate, I used to ask him, do you need my help? Should I teach you? I used to ask, you should discuss, but he was not willing to discuss with me, and he failed. I'm not saying that I am the perfect person. I will make sure you to pass. I can only guide you. I can tell you that you should study this way, and you should not study this. You should study this. You should not. You should understand. You should put MCQs like this way. That's what I can do. I can't put the knowledge into your brain. You have to learn. You have to cram yourself. The main reason is that you should discuss your shortcoming and everything with your mentor, with your friend. You should. I would recommend you must study in groups. If because as we used to study in groups, if I know the resuscitation better, and the other person who knows the trauma better, he will teach you trauma, and you will teach him the resuscitation. And when I am teaching, or you are getting teaching from LGM session, and like yesterday we had a session of shortness of breath, pneumonia, everything we learned. And on in this session, I was very keen to learn, and I was noting I learned a better way this session. But the today's session, that was about cardiology, and the other doctor, my friend, he was very keen, and he was very attentive. He learned better today. So when you will study together, he will teach you the cardiology, and you will teach him the other things, the respiratory. So that's how you will complete each other. So I prefer you must study in 2 or 3 groups, not more than that, but 2 or 3 groups. And either you are getting mentorship from me, anyone. Apart from that, you must teach in groups. That I would prefer. So the next date is on 11th September and 28th January, and the application date is 16 to 23 and 28, 4 to 11. You only need the 1 year post house job experience. Okay, after house job, 1 year experience, and you don't need any certificate. You have to only mention on the RCM portal that I am working in this hospital. If this is checked, they will ask you. You can get any experience, but you must go for exam. You must not worried about the experience letter. Okay. And the other thing, you only need the PMD certificate and house job certificate. That's what you need. Other syllabus who have already attempted, they know that SLO1, it has a 60. There will be 60 MCQs from it. SLO2 resuscitation 40 MCQs. SLO4 injured trauma patient 30 MCQs. Pediatric emergency 25. Procedure skills 10. SLO7 15 MCQs. I will tell you, when we attempted the exam in 2023 April, and the syllabus was changed and the marks distribution was changed in March 23, and we were going for exam on April. And we did not know that the mark is, anyone from us did not know. We were approximate 20 people who were going for exam. Anyone don't know that the mark distribution had been changed. Before that, it was 20 MCQ from procedure skill, and 30 or 25 from SLO3, and 10 from. So they have changed it. So 60 from SLO1 and 40 from resuscitation, 30 from injured patient, pediatric SLO7. This I have got all the information from the RCAM website. Okay, syllabus, everything. But we will share with you, everyone. Everything we will share it in the groups, and you can get. In the SLO1, allergy, cardiology, dermatology. Here you can 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, more than 20 topics. Okay, mental health, maxillo, nephro, neurology, ophthalmology, pain, pharmacology, respiratory, sexual health. These are all in SLO1. Other thing, all clinical SLO5. So if you go through the RCAM website, you will see that SLO5 includes some special PEDS emergencies like neonatal emergencies, safeguarding psychosocial emergency in children, and safeguarding in psychosocial, NAI, other many type of these, and neonatal emergencies. These are different, but they have mentioned all clinical syllabus categories as applicable to PEM. Okay, so you can get any question from SLO1. Patient pediatric, allergy, cardiology, derma patient, PEDS derma patient, PEDS endocrinology patient, PEDS ear, nose, throat patient, PEDS eye patient, PEDS nephro patient. Okay, so this all syllabus, which is PEDS trauma patient, PEDS, so that will be lie in the category of PEDS. So that's why you should not only focus, because emergency medicine. Okay, that can be from SLO1. I don't know why today there is a problem. No, I'm audible.
Yes, sir. Now audible.
Yeah. If I disconnect it, don't leave. Stay there. Okay. No, there is no need to do that in the full. That is for EBEM. Okay, for the European Board of Emergency Medicine. Just give me a few. I'm audible now.
Yes, sir. Audible.
Okay, so the next is procedure skills. So you can see that there are only mentioned the airway management. Okay, chest drain, external pacing, fracture dislocation, lumbar puncture, pain and sedation, focus, vascular access in emergency, IO, femoral vein, and wound management. So these all are important topics in the procedure skills. You will get question from only these topics. So RCAM, if anyone who have attempted already the MRCAM primary, they know that they don't give extra question. If they have said that they will give only 10 question from, please mute. If they say that they will give only 10 question from upper limb, they will give 10. They will not give 11 question. Okay, so that's what they are stick to their syllabus. The other thing you can see in last slide that they have, if I can zoom it, you can see that they have, if they have asked SLO1 60 question, so this was one question was omitted, so that's why it's 59. So they have given the 60 question, and if they have asked resuscitation, they have given the 40 question. From injured patient 30, from PEDS 25, procedure is 10, 15. So they will not give extra question, but they have said they will follow it. The other thing that's very important is the resuscitation. The resuscitation is a topic where you can get the maximum marks because it has a lot of
ऊपर ही है तो सीन वगैरह
please mute yourself.
बिल्कुल हल्का मीठा
Dr. Atik, please mute yourself. Okay. Okay, so resuscitation, it has a lot of weightage. So there will be 40 Qs from this resuscitation. So there will not only be a resuscitation of adult resuscitation. If you think that it will be only adult, it can be any patient of burn, PEDS resuscitation, toxic resuscitation, trauma resuscitation, any resuscitation, ATLS, PALS, ALS. Okay, any type of resuscitation, they can give the question. So you have to master every resuscitation topic. If someone is in UK and he has the book of manual of adult resuscitation and PEDS resuscitation, so you must go through it. That will be very helpful. They will give the lines of that manual. Okay. So injured patient, there will be orthopedic trauma and major trauma. So in orthopedic trauma, most likely they will ask the diagnosis, they can ask the investigation, they can ask the what's the next step. I will discuss what they mean by the next step immediately. So we have discussed the procedure skills and SLO7. That's very challenging. Everyone get confused and they don't know how to attempt this question. So there will be legislation and legal framework, organ tissue donation, information governance, safeguarding, evidence and guidelines. There can be HIV related questions. Okay. And there can be hepatitis B related. So these are complex or challenging communication skills. That's a challenging situation. So how the MRCM mark? Every MCQs is marked, correct MCQs are marked as 1 mark. So if someone think that you have to, how the marking is done, every incorrect is 0. So that's a simple. But the cutoff score, that is determined by using the NGUF methods. So that's not your problem. You have to get approximate your target should be 120 marks. Then you are confirmed pass, because every time the average passing score is from 112 to 118, 117. Last time it was 117. In September it was also 117. And before that it was 115, 114, 112. So this is the average passing score, 112. So your target should be 120 plus. The passing rate for MRCM intermediate is one of the lowest passing in all of the RCM exams. That's the main tricky thing. You must work hard. That's happened when you pass the MRCEM primary with the preparation of 2 months, 3 months, you think that you will pass the MRCEM intermediate, and you don't work hard. You give only a little bit time to SBA, and you fail. At the end, you fail. So at least you must give 5 to 6 months, a full time 6 months. You must give daily 4 to 6 hours, okay? And you make your own notes. If you will not do it, you will not follow what I am going to tell you, you are going to fail it. So is it easy to pass or difficult? Yes, it is easy to pass if you are following what you have been told, and you are making your own notes, you are getting the lectures, and you are attending lectures, live lectures. It's very important. There are many recorded lectures available on the YouTube. You will get every topic. You can read every topic on resuscitation. You can every topic on injured patient. You can get every topic on neurology. There are a lot of lectures available on the YouTube. But why it is important to have a live lecture? Be attentive in the live lecture. Either you are part of LGM or non-LGM. If you are affiliated with me or anyone, you must attend the live lecture. I have seen in my fellows of LGM who used to attend the live lecture, they pass on first attempt or third on first attempt. They are passed.
You already
And-
are. नोट्स वाले दिलवाले जल्दी से मैं निकलना
Why I am unable to mute? Okay. So that's very important. Yes, it will become difficult if you are not doing the smart study. Okay, you're not doing the smart study. So what are the important syllabus? So you have seen from the marks distribution that most of the people waste a lot of time on SL1. Who have done this way? I knew my colleague who passed MRCEM primary before us, and unfortunately she could not pass intermediate. And when we asked her that how should we start, and because she had already attempted 2 times, she said that I used to waste a lot of time on SL1. It's very lengthy. You can say, see, 1, 2, 3, 4, 25 topics. Cardiology, dermatology, ear, nose, all medicine, surgery, gynae, endo, everything, urology, vascular surgery, sexual health, everything is there. So if you will start from here, you will waste a lot of time. You will not finish it because we take a lot of time in making our tempo to start a good study and on daily basis study. So that's why people start from here and they waste a lot of time. Okay. So what field you should focus? Trauma. It has 30 MCQs, a very few syllabus. You can get 30 over 30 marks from it. The resuscitation, all the algorithm that should be on your fingertips, and how to implement them. That's very important because these algorithms are available on the resuscitation research council website. But how will you implement? That's very important. Toxi, you will get the question in the resuscitation from the Toxi. That's why I have put it in here. And you will also get about 2 to 4 MCQs from it. You will get 2 MCQs of adult from the I, 2 MCQs of kids. That's why most of the time they give 4 MCQs of I. And ENT, they the same. They will give the 2 MCQs of ENT from kids, from Toxi and SLO7. If you see, please mute your. Okay, if you will see, these collectively, I say, how many MCQs from trauma? 30. Peds emergency, because I have not included the SL1, you can say that 10, 15, leave the 10 MCQs, okay? 15 and 10, 25. 25 plus 55 and 40. These are 40. Okay. And these are 95. And from SLO7, 15. So these have become 110. And from these, you will get approximate 10 MCQ. So these are all making about 125 and plus MCQ, or you can say 130. If you include the 125, then it will become the 140 PEDS emergency. So you must start from first. You must do the trauma and do one topic from the SLO1. You can do the cardiology and then do the resuscitation on daily basis. You do the trauma, resuscitation, you must repeat it. We used to study this way. We focused on trauma, resuscitation, SLO7, procedure skills, and PEDS. And when we used to revise it, we used to revise the trauma and 1 hour or 2 hours for one topic from the SLO1. So that's how we used to study. So your main focus should be on these topics. Where to prepare and what are the resources? So I can't say that you must use one resource. There are no one resource for MRCEM SBA. I can say for the MRCEM primary, MRCEM success is sufficient and the quizzes of expert. So MRCEM success is very thorough. There are many topics which are written very good in the MRCEM success and some topics in the OHM, and you must RCEM learning. So if you pick one topic, I would say always study trauma from the OHM. That's very good. PEDS from the OHM. Ophthalmology, that's also written very good in the OHM. And if you can't find any topic in all of these, then you must, and when you are studying any topic, go for the RCEM learning. Because you must plan 6 months. If you will plan 6 months and you will make your own notes, mean you are studying the topic group. So you will first know how will you diagnose, what are the typical symptoms to diagnose the group, how to differentiate from the bronchial tracheitis, epiglottitis, okay, how to differentiate from the pertussis. That should be, you should write all these in the one go, and you will write your diagnostic symptoms, and then you will write first examination. In emergency, you do the patient has come, you take the history, sign, symptoms, and then comes the vital sign, then comes the examination, then comes the lab, then comes the management. So that's how you should prepare for the MRCEM SBA. Like you are seeing the patient in emergency department, how will you approach the patient? That's how you must prepare. You must make your own notes. So you can't study MRCEM success, RCEM learning expert at the same time. So if you are from LGM, I will say that go to the portal of LGM. Every session, clinical session, which have been taught by RCEM consultants, you must go through that session and then you must attempt the quiz. If any faculty member have taught you the trauma session, anything, first go through that lecture and then do the MCQ. That's how, and then make your own notes. When you are listening the lecture, make your own notes. That's how you must study. If you are not from LGM and you can join us, you can join any academy, either any of, and the main important thing, you must make your own notes. We used to, I have shared many times, and the people know that intermediate, we used to make the voice notes. Like if there is a topic and I have studied, I make notes, we used to make a voice note. We used to divide the topics. Like I used to say that Dr. Babar, make the voice note, make the notes and make the voice note of this topic and send it in the group, and made them. as I am conducting the session for MRCEM primary, and there are many people from LGM who are also attending. They are going for exam, and there are many people from PrepXperts. They are in group. I am saying to them from many days, please share your bullet points. Please share your bullet points. It will help you all. If one person is sharing 10 bullet points, other 10, so you will get the 20 points. You will remember it, but no one is sharing. So if you are sharing, that means you are completing each other. So where you will all get these all resources in a one time, you can get from us. And I can share if I have shared just a bit, but here's my, okay, just I want to show you. You can see the website. You can see the drive, Google Drive.
Yes, sir, we can see.
Oh yeah, good. So we have put, oh my God. Just okay, so you can see that we have collected all the resources in Google Drive. Okay, so LGM candidates, we have you can share your email, you can get it, and for other candidates who will join us, they will also get all these resources free of free. Okay, so you can see that we these are someone have shared my screenshot. This is my screenshot I put in LGM group, and you can see this is a Google Drive, all resources from all recalls. Okay, you can see that. So we have put all the topics, all things in here. Okay, very high yield recall. So from everyone, we have put them in one Google Drive. So you have all the resources, and this there is also book available here. Is also available here. Okay, you can see that these are books. IV book is available in Musa Isa, and nowadays we don't recommend the Musa Isa.
सब ठीक ठाक सुनाई किधर करात कर रहे थे हैं करात किधर
Okay, so all LGM trainees, you will send email to me or Dr. Asad. He will give you the access to view this material, and all the others who want to get, they can contact with the Prep Expert admin. Okay. So these are resources I have collected for all of you. Other thing I want to show you is that the most important thing that is very important. People confuse it. Who have attempted, they will know it, that what I want to say. Is it visible? Glossary of terms used in college examination.
Yes, sir, visible.
You can see the glossary of terms used in college examination.
No, sir, we can only see the folder, not the PDF file. It's not opened.
Just wait. Yes, this is here. Now you can see, I think.
Now we can see.
Okay, good. Okay, so LGM trainees, you can contact us in the inbox. Also, they will contact us in the inbox, then we will share with the. Okay, so these are the terms which have been shared by the MRCEM. Okay, so what does it mean by abnormality? What does it mean by characteristic, class of drugs, clinical findings? Please keep quiet. Dr. Ateek. Also unable to mute. Anyone would will call him that please mute. Okay, so you can see that class of drugs, clinical finding, commonest condition, what they mean by the condition, okay, for the intermediate. So for the intermediate with definitive management. So who have attempted the exam, they know they will give what would be your next step, what would be your initial management, what would be your definitive management, what would be your next step, what is your gold standard treatment. So that's how they ask the questions. Okay. So definitive management, things you would do in the department, but usually require you to listen the patient and procedure. Okay. That is gold standard treatment, which have been proven to give the best result. That would be a definitive management. If not available in where you work, either it's available or not. Okay. And that is definitive. If you have suspected that patient is having the appendicitis, definitive management will be appendectomy. So that's the definitive management. Okay. Patient have come with the the other is the disposition where the patient is sent following care in the ED, including the follow-up if discharge, ED management. That is their life or limb saving, or that might improve the course of the condition if done within that. That is not a definitive, but if you will do it, that will improve the patient condition. Okay, that can be life saving or limb saving. That these terms are very important. Other is essential, factor, feature. Okay, so immediate. This indicates that what will you do now? If patient has come with the inhalational injury and patient is also having the fracture of femur, so they will ask you what will you do immediate. So you will not put the facial block, or you will not put the you will not correct the femur. You will do the difficult intubation, inhalational injury. So that's the immediate management, what you will do now, rather than include within the general list of investigation, treatment that patient needs. Okay. If patient has come with the complete heart block, you are suspecting complete heart block, what will you do now? Immediate management, immediate investigation. These are, you will not ask that I will put the pacemaker. Okay, that's not the immediate management. What you will do first, what you will do, atropine, then external pacing. That's how you will do that. What's the difference of immediate? Implication, something that is suggested and hinted at. I will share this file with all of you, and you can read this, and that will be very helpful. Management, that aspects of care including treatment, supportive care, disposition, disposal. Measures, that which may include physical procedure, prescription, and referral, most likely. This requires the commonest or best known item. Like they have given the example of what is the most likely organism for UTI, you should list E. coli. Pre-alert, that means a radio call from ambulance, crew to inform the AD of an acutely unwell injured patient. That is pre-alert, recommended. That is the best according to nationalized guidelines. Symptoms, signs. So these are all categories which they have used. These are the abbreviation they can use in the exam. So you must go through this file. Okay. These are normal values they have also given. So, okay, now. Sure. Okay, so main thing I have told you that you must go through these topics. You must make your own notes, okay, from any resource. First 3 months, you must make your own notes. You must have completed all the syllabus in April, May, June, till 30th June, okay? And in July, you must do the second revision. In August, you must do the third revision. And in September, last 11 days, you must do the fourth revision. Why MRCEM success I recommend? You must do, that will give you the practice of MCQs. You must attempt MCQs from everywhere you get, of trauma, of resuscitation, you must attempt it. If you practice the MCQs, that will give you the idea how to pick the MCQs. Okay, anyone have seen the sample MCQs? Given on the website, who have seen the sample MCQ? Here are sample MCQs, okay. Yes, good. So first, everything in the SBA, every word is 60-year-old, okay, painful swelling with left knee, erythematous knee with a reach 20 degrees to 120 degrees, okay. So these are samples, they have asked the most appropriate treatment. First, you will know that what's the diagnosis, okay. Then you will give the most appropriate treatment. Other thing they are given that, oh, this is, you can see that clear and it's metamorphic from migrants, and other thing, these are rashes, the most likely diagnosis, other thing. Okay, so other important thing. Okay, so other important thing is that there will be 40% very easy question, 30% intermediate, and 30% will be very difficult question. Okay, you must not miss the 40% question. That means 70%. 70 marks you are going to get from the easy questions. So there will be easy question that will be 40%. You must not miss it. Okay, how will you not miss it? If you have studied smartly and studied thoroughly. So what I have given you the plan, we are going to start our 5 months course. That is not expensive. That is for non-LGM. Okay, not for LGM. Always remember it. Who are in current batches mean 3, 4, 5, they can't join. Who have left the LGM, they can join. Okay, because LGM will conduct, we will conduct our own course at the LGM. You will get a lot of teaching at LGM. So you may not need to join us. So other people, your friends who want to join us, we're going to start from the 10 April, 5 months course. We will revise approximately 2 to 3 times course in these 5 months with our lecture. Okay. So any question, if you have any question, you can ask anyone. LGM, non-LGM, anyone. But I will say that people think that we should, as LGM people, they are lucky that they are getting a lot of teaching, and you must focus on all the sessions. You must give a weekend to your studies. If the Dr. Shoma is teaching, you must note every point. If I am teaching, if Dr. Rida is teaching, Dr. Ash is teaching, every point, Dr. Nala is teaching, every point is important. You must make your own notes. I will share some notes of Dr. Mariam Nawaz. She used to make notes with the lecture. I used to type because I can't write. I used to type, quickly type. I used to type every lecture, every point, and then I used to save it and used to share it with my colleagues. So that's how you will also make your SL, CBT if you are typing. If you are non-LGM and you can't spend on yourself, that means if you can't spend 40,000, 50,000 for 6 months, 10,000 per month on yourself, then you must not be a big dream. That's what. There are many people who have joined the Alamein, they have also failed. So any course you want to join us, you can join us and you can join any course. I would not say that this is not good course, but I will say that anyone who was affiliated with me in MRCEM primary and afterward who used to study with me for intermediate, they have alhamdulillah passed. Any question? Any question you can ask me, okay? And who are non-LGM, I can share my number. You can contact me. WhatsApp, okay? Because all LGM people know me. It depends on you. Some people will study 6 hours and they will not get anything from it. Some people will study 2 hours and they will get a lot of knowledge from it. It depends on whenever you study with the full concentration. I listened some of the scholar. He was telling that what the concentration is. He said that when we were in our childhood, we used to listen that we will put a convex lens in front of sun and on the paper it will burn out. But he said that if you are putting sun and paper and you are moving like this, it will not burn. If you are still with the concentration for a few minutes, then it will burn. That's what the concentration is. When you are studying, I had a friend in my childhood, when he used to study, if the bomb has blast with him, he don't know. So that means you must study with full concentration. If you study 2 to 3 hours, that would be sufficient. If you will study uh, with many distraction while anything for 8 hours, that would not be sufficient. Okay, so for people who are asking for the other parts and introduction, so you can contact me, you can join the group. So I have also, if I can send you the link. I have done a comprehensive session on MRCEM pathway. How can you pass it in 2 years, 3 years? An introduction of MRCEM. So we have guided you all, and for the LGM, you must come forward and start teaching each other and helping each other in the intermediate group. And for others, you can join us, and we will help you to pass the exam. Who are asking for what's your name? I don't know, but every course is good. It's on you. Because I think Dr. Honey provides a recorded lecture, but we will give you the time, we will discuss the MCQs, we will teach you, we will give you the mentorship. That's what the difference is. Please contact that. Okay, so there's no question. Ibrahim, Dr. Ibrahim is here. Ibrahim from batch 2. He has already passed the exam in a 1 year after house job. He is very lucky. No, he can't appear in the OSCE because he has to wait for 1 more year. Okay. No, I think the MRCEM, you don't need to waste the money. You can buy for 1 month. All PDFs are available. All offline sources. You don't need to waste money on MRCEM Success or MRCEM Expert. They are important quiz in the MRCEM Expert. So and the PDF are available. So you don't need to waste money on that. Okay. I think they are charging 150, another 150. You can do many things in that. So all the PDF available, but you can only get the subscription for American Success Expert collectively in the last month to practice the MCQs on online. That you can do. Okay, so Asad, please also share my WhatsApp group here. What do you want to ask? Sharing it. People who are from batch 5, they can contact me. The people who are from batch 2, batch 3, they can contact the Asad. Dr. Faz, what do you want to ask? Thank you for the session, Dr. Curtin. Can you summarize to prepare for MRCEM interview we just missed? Thank you. That will be uploaded, Dr. Hasnath. I am not able to reply you. What? Dr. Hasnath. Recording will be available. No, we have left. Any other question I have missed? Can you advise how to prepare for American Intermediate? I missed the intro. Can you please elaborate briefly how long it takes? Topic in Amazon Success Server detail, how to approach them, how many hours, the question which I have missed. Okay, I think I have covered all of it. I hope it was useful. That help you, and but you must start preparing from today. Criteria changed. It was not mandatory before. 2 years medical experience required for SB. No, it's not 2 years. It's post graduation 2 years, including the house job. So post house job 1 year experience. Okay. Post house job 1 year experience. Please, I am also in both groups, 2024, 2025, batch 3, 4, 5. You can contact me. Either you can contact the Asad. Okay, thank you very much. We're going to end the session.
Thank you very much, Dr. Tazar. It was really comprehensive session, and this was much needed because proper guidance was not there, but it really helped us. Thank you so much.
Okay. Thank you. I want to thank to the admin of PrepXpert team, Dr. Vajifran, for choosing me this webinar, and as a mentor of MRCEM, I have also thanked to the LGM and my mentor, Dr. Ash, who made me this capable to conduct this webinar. Thank you very much.
Thank you so much, sir.
Okay, ji. Allah Hafiz.
Allah Hafiz, sir.
Thank you, Dr.
Jazakallah.